Today we have Dr. Kelsey Louie with us. He's a family doctor who works with the First Nations Health Authority as a senior medical officer, and he's here to talk to us about vaccines and vaccine hesitancy, just because we are on that push to get to community immunity, and there are still some people who are hesitant. So why not talk to a doc? So welcome, Dr. Louie.
Hey, Shar. Pleasure to be here.
Yeah, I'm glad to have you because there are a lot of people, like I said, who are still hesitant. We want to ensure our community safety by getting to that community immunity. Just some questions that come up frequently. A lot of people are asking about getting their children vaccinated. If their symptoms are mild, why should they still get the COVID vaccine? Because they do say kids don't get it as bad as adults, but we're still trying to get them vaccinated.
Yeah, it's a great question. And something that we're still finding more and more information as the whole pandemic evolves. So I think initially, we tried to target and prioritize, sort of through a bit of a system of trying to target the highest risk, which tended to be, our elderly or our seniors. But we also recognize sort of how our communities really work, which fluctuate. A lot of people come in and out of communities. We, live amongst different homes and visit people quite frequently. Our communities are quite transient, if you will, and this includes our children as well. So I think some of the things we've learned is young people carry just as high a risk, in having bad outcomes from the vaccine, or not from the vaccine, but from the pandemic. And from COVID, which, I don't know if we necessarily have enough information around youth and children, but we have seen deaths in those who are under the age of 30, which is alarming. And, to me, that's something that I don't necessarily want to take my chances with, if you will. So we're learning more and more information around the safety of the vaccine, and just really trying to support our immunity to be able to fight off and really limit what we can in terms of what the COVID vaccine or COVID virus does to our bodies.
I kind of wanted to talk to you about the fact that I've been reading some statistics about men versus women who are getting the vaccines, and it seems like there are fewer men than women lining up to get their shots. Can you kind of talk a bit about that and why that might be happening, or what your encouragement is to some of those men that might be vaccine hesitant?
Yeah, we've certainly found through our data and tracking of just numbers, community members who live on and off reserve, and the general population, more and more women compared to men have received the vaccine, have walked through the door and sort of undertaken that. And, the answer as to why, I can only speculate at best. I think, it's something that I've stepped forward with. I've seen other men step forward with, and it's, something I put out there to, I would like to see our men step up and really do, hopefully initiatives and take on the challenge to really help protect their health and wellness, not only for themselves, but for their loved ones. And I don't know if it's, just something where, we sort of joke, we hear men tend to be more stubborn than anyone. And I don't want to claim that's true. But all I can do is try to encourage men and showcase, those who've taken those steps, including myself, and really encourage our fellow men out there to step forward and look to protect themselves in the best way possible.
So now I have some more specific vaccine questions. There are a lot of questions surrounding these vaccines. I want to know specifically, first off, how long are they valid for? And do you think we're going to need some booster shots going into the future?
To the first, I don't know. To the second, I don't know. How effective are they will definitely remain to be seen. I think, what we're hearing from our colleagues who have been studying this very diligently since this all began, and continue to track the data and look at all the sort of statistics and things that we can kind of gain access to. It's proving to be quite effective for those who have undergone. How long it'll last for really remains to be seen. And same thing when it comes to, do we need a top up? Will we need a booster down the road? Again, kind of remains to be seen. Whether this turns into something like the annual flu vaccine, where we have those campaigns and we enter flu season and encourage people to get that on a regular annual basis. I think we'll just continue to learn about this virus and what's sort of required for our immunity against it.
So let's talk about traveling, because I know a lot of people, once we hit phase 3 in BC, we're just super excited to get out and travel outside of the province, maybe even outside of the country. Do you think people are going to have to be vaccinated if they're going to want to leave the country and fly to these wonderful destinations in the future?
Can't we all just get back to traveling or have the option? I'm with you. I would really love to be able to travel, not even, anything exotic, but even within my own health authority and traveling to my home community. It's something I've missed for a very long time. And, to protect not only the community, but myself, and to follow sort of public health guidelines, I've had to refrain from that. But I'm really hoping that'll open up and I'll have those opportunities again, along with everyone else. In terms of whether we're going to need to have vaccinations or proof of vaccinations in order to travel, all we can sort of do is follow the recommendations from the federal government. And it will remain to be seen, depending if we're doing international travel or going to other countries, their governments will have probably different regulations or, sort of different requirements in order to maybe be able to visit certain places. So, I think certainly having the vaccine will probably allow us to open up more opportunities and more doors down the road. But, whether those are required or not, that'll remain to be seen.
Another thing I want to talk about is flu season, because kids are going back to school. I know they don't want to hear this, but they're going back to school in about a month from now. And that's typically when people start getting colds and flu season comes around the corner and people start lining up their flu shots as well. So is there any problem with getting the flu vaccine within a short amount of time from your COVID vaccine? Like, should you wait a while, or is there any issue with that?
So the way I've looked at it typically is I do this, sometimes as a family physician, when I see a patient, if I'm treating them for something and I need to give them multiple medications, we'll try and stagger them. We'll try and not give them, 2 or 3 or 4 of them all at the same time, because whether something works or doesn't work, if it has a side effect or not, it's really hard to determine which one might have caused it. And I think we kind of take something similar when it comes to vaccines or injections, immunizations, in terms of, it might be difficult if you give them at the same time and maybe you get a reaction, whether good or bad, to determine which one might have caused it. So in general, I think they've been recommending, maybe 2 weeks between receiving, other immunizations or vaccinations to give yourself a break. So if you get the COVID vaccine, try not to have something 2 weeks before or 2 weeks after, just to allow that period where, if something was to go sideways, if you will, then you would kind of have a more clear, definitive answer as to what might have caused it.
And as far as types of vaccines, I myself got Pfizer at first, and then I got AstraZeneca second. Why are there different kinds of vaccines? What happened there? How come? I know there's a lot of people that are kind of confused about that as well. There's, they were talking about Johnson & Johnson before, Moderna. Like, why are there so many different kinds?
Yeah, well, we hear about all these sort of different names, and what you sort of describe are what we sort of big pharmaceutical companies. and they all sort of live in different countries, if you will, people doing different research that come out of different areas of the world, who are studying different things. So when we talk about sort of private companies, if you will, or big pharmaceutical companies, they're all in some respects working towards a common goal, but also utilizing their own sort of research and what they have available to them, their own scientists and researchers and people who work in those fields, really trying to create something. And they all often stand independently, but I think as we've sort of learned through this pandemic, a lot of them have come together and started to share information with one another to really try to come up with sort of population-based solutions to, trying to get a vaccine out there that works, and then having multiple kinds that maybe all have little different sort of tiny nuances to them that provide sort of different protection in different ways. But it can be kind of confusing when you hear all these different names of all the different companies.
And the virus right now, we've heard that it's mutating. There's the Delta variant, and a lot of people are concerned about that. It's been showing up all across the province, all across the world, really, all these different communities. Will the vaccine still work if the virus is mutating?
What we kind of learn about viruses is, they could be smart little buggers, and they, like many others, look to try and adapt to their environments and change so that they can survive. And we sort of hear that, survival of the fittest, and things over the years, things adapt to their environments so that they have the best chance of carrying on. Viruses with the mutations are sort of no different. We've found that the vaccines thus far have been quite effective in protecting ourselves and building sort of a good immune response to recognize when the virus is present. And so far, with the different variants that have come out, we have a pretty good general immune response to many of them. Whether that remains in the future will be, sort of like, again, difficult to say at the moment. But I think that's where, a lot of our scientists and researchers and people who work in this field continue to follow the virus and study it, and the vaccines that work against it, to ensure that we have as best protection as possible.
So earlier on, I was kind of asking you about, or talking about, community immunity. With the timeline or the time frame we're working with right now, and with how everything's going, when do you think we're going to get to that point?
So I think when it comes to the concept of herd immunity, or community protection, with this, it's really difficult to sort of pinpoint a rough number, if you will. I kind of alluded to earlier, with travel restrictions kind of lowering and people being able to move, come and go more frequently. We know in a lot of our communities that they are very mobile, they are very transient, and people come and go. We have a lot of extended family visit different communities. So while we're trying to have, the vast majority of our communities vaccinated and protected, that can provide sort of very good protection for the actual community. But at the same time, we might have people coming in and out, and you never know if you're going to lose a bunch of people who are vaccinated, they leave the community, a bunch of people who are unvaccinated to come into the community. Now, do we still have that rough threshold? It's very difficult to say. So in my opinion, the more the merrier, in terms of the more people we have vaccinated in the community, it's going to be better for the entire community, particularly those who are unvaccinated, and will provide a little bit more protection as people come and go.
And what about kids? I know that they have approved it for kids over the age of 13, but what about kids under 12? When do you think the vaccinations will be available for them?
That I have to leave up to the experts working on it. I think up until this point, the Canadian government and our, provincial public health officers and, the office there have really been continuing to look at the data and statistics and are really trying not to make sure we put anything out too quickly that would pose any sort of safety risk to those using it. And one of the challenging things when it comes to some of our, I guess, special populations, if you will, which may include youth and children, maybe pregnant women, and others. It's hard to, I think, get a big enough cohort of those involved to really study at times. And so, you don't want to maybe run the risk of vaccinating people too soon, too early, without having, a general sense of how it works in others. In our case, we're looking at, healthy adults, healthy seniors, our general population, and trying to learn from it, and then continuing to, review and meet with experts involved in those special populations to determine, when is the best time and when are people, really safe with this. So I think we continue to get more information, and as it comes out, we'll likely see these being offered to those younger and younger.
And if somebody has any health conditions or previous medical history that might be concerning, should they talk to their doctor before they get immunized?
As a family physician myself, I always encourage and welcome conversations with my patients, and had the opportunity to work with our First Nations virtual Doctor of the Day service. And we have many community members, both on and off reserve, who have been able to call in, and sometimes it's just asking some general questions around the vaccine, the safety, just asking about general questions that they've sort of heard out in social media or through friends and family, and just not sure about it themselves. Or some may have underlying medical conditions that they're just not quite sure. Will this mix with my medicines okay? Will this affect me or my condition in some way? So I'm always encouraging to have those conversations and to try and keep an open door regarding it. Some people feel pretty confident in the information that they receive and comfortable going forward. I think on the day of any kind of administration, there's always a nurse and supports at most of our vaccination clinics and sites to help answer any of those maybe last second questions. But if it's, if people are thinking about it ahead of time, I encourage them to speak to a healthcare provider and just, reassure themselves of any questions that they might have.
This is a question I know a lot of people will be excited for me to ask. If I've had both of my vaccinations and it's been over 2 weeks, can I get rid of my mask?
Yeah, it's a good question. I've yet to get rid of my mask, and I've kind of just followed, I think, what's still been some of the general recommendations from our public health officials. I think recently it's continued to change, which has been one of those challenges that I've heard from many of my patients and community members, is throughout the pandemic, there's been continuous change as we receive more and more information, and in response to how we're doing as sort of a population. I think now we're kind of hearing some of the health authorities who don't have as high vaccination numbers as others, and new sort of recommendations around wearing masks, whether in public or in sort of closed facilities. I've kind of just personally taken the stance that even though I'm double vaccinated and feel healthy and protected, I work with others who it's hard to know if, what situation people are in, whether they're vaccinated or not, whether they have underlying medical health conditions that might pose more risk to them. And I recognize that, I myself, while I might not be necessarily, infected or feeling like I might have COVID, I could be a carrier and I could expose others. So for my own protection, I continue to wear masks in certain situations. And I'll kind of continue to follow what the general sort of public recommendations are. But I also love the fact that I've been well. I haven't caught the flu. I haven't had any sort of real respiratory illnesses since I started wearing masks. So some respects they've been a little bit of a nuisance, but I've also become quite accustomed to it also being sort of just a part of my everyday attire.
All right. And finally, like you just said, you are doubly vaxxed, and it is a personal choice, but what was your personal reason why?
Was really, I think, to give myself the best opportunity to stay healthy and well, not only for myself, but for my loved ones. And for those who I work alongside and work with. I recognize, as a frontline healthcare worker, I've had not only the privilege, but a sort of a responsibility to continue trying to serve, the people who I work with. And in order to, I think, best protect myself, but also protect them, I saw it as, one of those avenues that really helped support me in my wellness. So.